It shuts you down. Do your headaches prevent you from enjoying life? Do they cause you to have to cancel plans with friends or family or even coworkers? Do they prevent you from enjoying your hobbies? If this is you, then this video is for you. Providing you with pain relief strategies and wellness solutions for modern day living. In this video, I'm going to share with you my top 4 tips for immediately relieving headache or migraine pain from the comfort of your home. My name is Dr. Jon Saunders. I'm a chiropractor here in Newmarket, Ontario, Canada. I've spent the last 17 years helping people with spinal-related conditions, including headaches and migraines. In the last 17 years, we have seen hundreds and hundreds of patients who have been suffering get better from headaches and migraines. This is a topic of interest for me because I used to suffer from migraines myself. In fact, I became a chiropractor because chiropractic helped alleviate my pain from headaches and migraines. Maybe your pain is like a vice grip around your head, like a band-like. It sometimes might be throbbing. It could be on one side, it could be on both sides. I understand. While it's frustrating because it does affect your quality of life, today in this video, I'm going to show you my top 4 strategies that you can implement at home to help give yourself some immediate pain relief. Before I give you my top 4 tips on how you can get immediate relief in the comfort of your own home, I want to discuss where headaches come from. When you're suffering, there is nothing you want more than pain relief. If we can understand the tissues involved, we can be very precise and specific in helping someone get relief. One of the first things we want to look at is trigger points within muscles. These are muscles that are overworked, and in today's day and age, they get overworked because we're looking down at our phones or on our tablets. There's 7 cervical bones, and each of them are very important in terms of how we move our neck and the location or position of those bones. Now, we expect to see a nice, smooth curve. And why that's important is that when your spine is in a line, especially your neck, the bones will move freely and the pressure will be minimal on the discs and the nerves and the blood vessels. Now, the top 2 bones in the neck are very important. They are the bones that allow us to move our head up and down and from side to side. So we want those bones moving properly and in the right alignment. These tissues, when they become inflamed, they can refer up to the head, causing a multitude of different symptoms, from nagging pain, from tightness around the head, to that throbbing, pulsating pain. We basically have a nice, smooth curve. The top 2 bones are angled at a specific angle, and we can tell that when the neck is like this, there's little to no pressure on the nerves or on the joints. The upper neck region is often one area that's missed when assessing someone for migraines. When the discs start to narrow, and you can start to see this disc is narrowing, there's bone spurs, they irritate the nerve. One thing that we want to make sure is if there is damage in the neck and degenerative disc disease, is that we start to allow that to move better and function better so it can take the pressure off the joints, reduce inflammation, and reduce the risk of a headache or a migraine. We know that if you address the cause of a problem specifically, there is relief available. Here are my top 4 tips to get relief from headache and migraine pain in the comfort of your own home. Headache pain or migraine pain that may be originating from those trigger points. We're going to take our 2 fingers and we're going to come to the back of our skull. We're going to come off the back of the skull into that suboccipital triangle area, and we're going to apply a little bit of forward pressure into those muscles. And what you want to do is you want to find the most tender spot in those muscles and just, again, drop off the back of the skull. Drop off the back of the skull, find the most tender spot, and apply a little bit of pressure. What you're going to do is you're going to hold these spots for a minimum of 10 to 15 seconds, and you can do this multiple times throughout your headache or migraine episode. You will find that once you get on the right spot, you could feel tenderness right under your fingers, or it could cause a referred pain along the path of that trigger point. The second tip is skull compressions. What you're going to do, you're going to take the thenar and hypothenar areas. So basically, you're going to take the base part of your hand. You're going to come off just above your ears into your temple, flex your head slightly, and you're going to squeeze, holding for, again, 10 to 15 seconds. The concentration of pressure is going to be inside temporalis muscle, which is a fan-like muscle. You're going to squeeze, slight head flexion. You're going to feel a very little bit of give, and most of that's going to be coming from this area, but that's going to be your gauge to know if you're putting pressure there. You should feel immediate relief while you're releasing that area off that temporalis muscle. For the third at-home tip to relieve headaches and migraines, this was probably the most effective one for me while I was suffering from migraines. It is temperature therapy. So this can be done in a variety of ways. One of the most common ways people get relief, and with hundreds of patients, the advice I've got back from people that this was very effective, is a hot shower. A minimum of 20 to 30 minutes, as hot a shower as you can take on the front of the head. You can alternate between the front and the back. This does a few things. It increases blood flow to the brain. It causes vasodilation of the blood vessels in the neck. And it also decreases pain signals from the brain. The other way is very effective, but it needs to be done correctly. Any type of cold pack, and then I really prefer a hot water bottle. It holds the heat well, and it contours to either your neck or your head. Now, the most effective way to use heat and ice, in my experience with both when I suffer from migraines and the patients that I see with these conditions, is to use the cold on the forehead. You want to place it on the forehead. You want to do this for about 10 to 15 minutes. Now, to make this more effective with temperature therapy, the 10 to 15 minutes of cold followed by 10 to 15 minutes of heat in the back of the neck with a hot water bottle. The key though is alternating between the front and the back with either heat or cold in about 10 to 15 minute intervals. And finally, for the fourth tip to help you get immediate relief from headaches or migraines in the comfort of your own home, we go back to the upper neck. The upper neck is often missed in terms of searching for the cause of a headache. There are tremendous amount of pain sensitive tissues in the neck that can cause headaches. One of the biggest causes in the neck is a lack of proper alignment, that nice smooth curve, and a lack of proper motion, especially in these top two bones. It irritates spinal nerves. It can cause a decrease in blood flow in the blood vessels in the upper neck and into the brain. It's very important to treat these appropriately. The first is simple. It is using a rolled towel. So you can roll a towel to help support the neck. We want to support that neck curve with this towel. Get a size that will fit your neck. This is not to be used on the back of the skull. We want a nice, smooth curve. That is the easiest, simple way to help restore some curve, take pressure off the discs, let the blood flow and nerve flow increase to help reduce the symptoms of a headache or migraine. If you want a bigger stretch, is to literally just come off the edge of a bench or a bed and let the weight of your head pull that neck back appropriately, and that will help again realign, stretch out the discs, open up the blood and nerve flow. In order to get in the right position, you shift back, let your head, use the weight of your head to hang off, keep your shoulders opened up, and you will notice a nice, smooth stretch. That feels so good. While a foam roller is really good to help release trigger points and immobilize the thoracic spine and the mid-back, what it's not good for is my tip number 4. It's too big, typically, to fill that nice smooth curve, and it forces your head forward into a position that will minimize the stretch. I hope you enjoyed these 4 tips. Again, just to go over, it's the trigger points, both in the upper neck and the compression of the skull around the temporalis muscle. It's the temperature therapy, and it's the stretch of the neck, the upper neck, to get those bones in the right alignment and then moving properly. I hope you enjoyed this video and found it useful. I really believe if you apply even 1 or 2 of these 4 tips, it'll help you get some immediate relief while you're at home from headaches and migraines. If you have a question, comment below. I'll answer those questions. Tell me which one you like the best. Tell me which one you felt gave you the most relief. If you have an opportunity to share this with someone that you think might need help, please do. Hit the like button, subscribe, hit the notification bell. My name is Dr. Jon Saunders. I'm a chiropractor here in Newmarket, Ontario, Canada. I hope to see you in the next video, and until next time, be well. To learn more how you can get pain relief from common spinal-related conditions, please visit us at www.chirofirst.ca. Our office is located Chiropractic on Eagle in Newmarket at 407 Eagle Street, Newmarket, Ontario, L3Y 1K5.